Hi, my name is Daryl Baskin, and I wanted to spend a few minutes going over what age-related macular degeneration is for patients that have this condition or have friends or loved ones that have it as well. I'm going to try to keep it not too technical. I don't have any financial conflicts to disclose. So what is macular degeneration? Well, it's primarily a genetic disorder. Some have proposed calling it gene-related maculopathy. There's at least 52 different causative genes that have been identified. In general, if someone loses vision from macular degeneration, they usually have at least 2 or 3 out of the big 5 genes. And although it is primarily a genetic disorder, there are some lifestyle changes that can be made or that might actually make it worse or better. So cigarette smoking does make it worse, no surprises there. There's 3 main things that I advocate my patients do that can actually improve their disease course, and one is taking the eye vitamins. The AREDS2 supplements, which have been extensively studied. I'm pretty much brand agnostic, Costco, Walmart, Walgreens. You can get Bausch & Lomb or eye caps, Ocuvite, Preservision. There's a lot of options. They are rather large. They are 2 pills a day, and if you have trouble with one or swallowing, I would recommend trying a chewable variety. But they have been shown to delay the onset of the wet form, and in more recent studies, they seem to slow down the dry form as well. And we'll get into the wet and dry form in a moment. Exercise has been shown to be of benefit. 30 minutes of brisk walking 6 days a week has been shown, as well as additional exercise is of greater benefit. In other words, there's a dose response curve. The more exercise, the better. I also realize that many of my patients with macular degeneration are not able to do so, or certainly aren't able to go out and run a marathon. And then the third thing I recommend is a Mediterranean diet. This has been shown in the iRisk studies and a couple of others in Europe primarily, and it has been also shown to decrease the progression, or slow down the progression, I should say, of macular degeneration. So we'll talk about the dry form and the wet form. Those really aren't my favorite terms. The dry form is characterized by drusen, which you can see here. I've circled in green. Those are little yellow dots when we look inside of the eye. They're at the level of underneath the retina, or underneath the retinal pigment epithelium. That's the layer just beneath the retina. You could think of it as waste material that's accumulating and not being properly disposed of. At this stage, a lot of patients don't have symptoms or have very minimal symptoms. Another characteristic is something called a retinal pigment epithelial change, or pigmentary change. And this is usually at the point where some patients will start to notice some changes in their vision, such as distortion or less resolution than normal. We use OCT scans to monitor disease and to detect leakage. I've got one here that you can see. This is just a cross-sectional scan that goes through the retina, and this is non-invasive. We can acquire these without dilating the pupil. Extremely helpful in monitoring disease. At some point in the future, there will probably be a home OCT device that can be used much more conveniently than coming into the office. And I've circled a druze right here. You can see that elevation underneath the RPE, the retinal pigment epithelium. And we also can see more advanced disease here. There's some little areas that I'll highlight in a moment of what we call atrophy, or wasting away. And on this OCT scan, I put a rectangle around an area where there's too much light penetrating through the retina and the RPE, and we can see where the atrophy is there. Another way that we can monitor that is with a fundus autofluorescence photo, and you can see that here. The blacker areas, in this case, represent RPE atrophy. There are other things that cause black on this image. This is a blood vessel or optic nerve that are normal. And we can measure the growth of these atrophic lesions over time. It does progress, unfortunately. So it is an inevitable progression to widespread atrophy in the macula over time. Unfortunately, if someone lives long enough with macular degeneration, they will eventually lose central vision in that eye. It is actually the #1 cause of legal blindness in the developed world for folks over 60 years old. So I think of it this way: it's sort of like you're starting out with earlier disease, intermediate disease in that lower left-hand corner of the screen, and then it's like you're driving the car down the highway, and eventually you're going to arrive at vision loss. unless we come up with a cure. And then sometimes there can be a detour. So you're driving along and then you end up with leakage, or in this case, hemorrhage even. Not all wet macular degeneration does involve red blood cells. In this case, this picture does. It is a worse prognosis if blood is involved as opposed to just leakage. And I use this concept to explain why wet and dry macular degeneration sound like mutually exclusive terms, but they're really not. In English language, in our parlance, we talk about a towel being wet or dry, but not both. But in this case, once you have wet macular degeneration, you actually have both wet and dry. You don't stop having the underlying dry form, unfortunately. So I think of the wet form as being like an add-on, like you order some fries and you add some ketchup on top. So maybe not a good analogy, but the idea is that when someone has wet macular degeneration, they still have the underlying dry part. And oftentimes, even when their wet macular degeneration is being adequately treated, they can still lose vision because the dry form begins to erode away at the underlying tissue, the RPE in the outer retina. So let's go a little bit into treatment options. This picture that I have here is intermediate level macular degeneration. And at this point, we don't have a treatment that stops or reverses any of these signs of disease. And again, we do recommend those three things I mentioned earlier: AREDS, 2 vitamins, the supplements, exercise, and Mediterranean diet, because they've all shown to slow the progression to advanced stages. And then we had these roads that they don't really bifurcate, but again, you have two sort of levels of advanced stages in terms of thinking about different treatments. One is geographic atrophy. That's where you get those dark spots where we've lost some of the integrity of the retinal tissue. And then you also have neovascularization. That's the wet form of macular degeneration. I apologize for using longer words, but sometimes more precision is just necessary. So for geographic atrophy, there's no treatment currently, and this is July 2023, that stops or reverses these signs of disease. There was one FDA-approved medication, FDA approved earlier this year, that slows the enlargement of the atrophy. It slows it by about 17 to 20% per year, and it's an injection of a medication into the eye every month or every other month. It's somewhat problematic in terms of its side effect profile, and I hope to go into that in a lecture that I might publish in the future. For now, just suffice it to say there is an FDA-approved treatment. There may be a second one that comes out next month. And then going back to our slide here, you can see that we're going to talk about treatment options for neovascularization. There's quite a few FDA-approved treatments at this time, and several biosimilars that are out and more to come. Timely intervention is extremely important. If someone comes in just 3 to 6 months after they have symptoms that begin, we may never get their best vision possible. In fact, we may not get very much vision back at all. Symptoms are typically when someone's looking at a straight line, it looks crooked or wavy, or they see a dark spot in the center, or patients describe to me as like a dark shadow, but just in the center, or a kidney bean that just showed up in the middle of their vision. Almost everyone does have symptoms when it starts. I've had very few patients that were unaware that they had the wet form. Certainly at the point where if it bleeds, it's very noticeable. We do sometimes catch it before they have symptoms in clinic when they're coming in every month for the other eye getting treatment, perhaps. Speaking of treatment, the treatments do need to be repeated on a fairly regular basis because none of these currently available are curative. So it's a little bit like taking blood pressure medication in the sense that once you stop taking the blood pressure medication, your blood pressure goes back up. Once you stop taking these shots or these treatments in the eye, there is a risk that the disease activity will return and vision loss can happen. About 7% of people can be weaned off of these shots, but even of those 7%, 50% will have a recurrence within a year, usually around the 7-month mark. Most patients do achieve substantial visual improvement, and that usually, most of those patients get to that new best vision, whatever that is, around the 6-month mark. So I do hope to have a lecture on choices of medication in the future. For now, just know it's very important to see a retina specialist right away. I've sadly seen many patients that waited because they thought perhaps it was a cataract or a secondary cataract, when in fact they actually had some bleeding or leakage due to macular degeneration. Here are some of my references. I just want to say thank you for your attention, and please do contact a retina specialist if you have further questions. And a couple of really great resources are at ASRS, American Society of Retina Specialists website, and the American Academy of Ophthalmology. At ASRS, I often direct my patients to go to the For Patients link, and there are many downloadable PDF files that can describe disease states there. Thank you for your time. Have a great day.